I'd like to call the Government House meeting for, this is May already, to order. First order of business, I would like a motion to accept the minutes of April 20th, 21 as mailed. Motion by Paul, do I have a second? Lester, second by Lester. Any omissions or corrections? All in favor? Carried. Department, Matt Jones, you're up.
Hang on here. So this
Hi,
month
Matt.
I just have a short update, and that's on the roof at Burgoyne. We're 99% done. And there's just a small punch list left that I went over. The warranty company was out. We did a full inspection last week. Everything's looking good. So that's my update on the roof. And the other update was our public health move. We approved hiring the engineers to, or the architect to do the architectural survey on the application. The only holdup right now is still that public health is way behind. Our New York State Department of Public Health is way behind on their application process. So we're kind of a little bit in a waiting game for a meeting with them. That's what I have.
Okay. Good. And any questions for Matt? Mr. Hicks?
Everything's still a go for the beaches for this year.
Yeah.
Everything's straightforward, same as previous years, and everything's under control.
Yep, everything's straightforward right now. Actually, the restrictions have loosened up a little bit. The only thing we've done is the pavilion rentals. We've limited it to one party. They have to rent the whole pavilion. We used to divide it up. It holds 200 people. We used to divide it up into quarters, and you could rent, 50, 100, 150, or 200. It's one party per the 200. So if you had 50 people, you're just going to have to rent it for the full 200. That's really right now the only difference. Minor differences like keeping the hand sanitizer and stuff like that for public use. But we did that last year too. So.
Thanks, Matt.
Okay, thanks. Any other questions for him? Now on to County Administrator, Melissa.
Good morning.
Good morning.
Yes, I have on the agenda this morning the smoke-free workplace policy. Currently, the county has a policy that was adopted in August of 2003, revised in March of 2006. The policy defines smoking as burning of a lighted cigar, cigarette, pipe, or tobacco product. And it's in adherence with the New York State Public Health Law, which states that smoking is not allowed in the buildings or in the county vehicles, but that smoking is allowed on the Washington County Municipal Campus at the gazebos, which are located in the back of the building by the parking lot, and also at the law enforcement center. But I do want everyone to know that the gazebo in the back parking lot was removed a few years ago. So that is the current policy relating to smoking. The subject has recently come up with the legalization of cannabis, and in discussion with the working group that was formed to discuss and get through the red tape of the legalization and what that means to us as a municipality and to our employees. The discussion took a turn and the subject of whether or not we wanted to become smoke-free altogether, or if we wanted to talk about the designated places to allow smoking. We do need to keep in mind that anywhere that tobacco is allowed to be smoked, so is cannabis. Now, I do have to add also that employees are following the Employee Handbook, which we have the drug-free workplace policy stated in that, and that does state that employees are not allowed to smoke cannabis during work hours. So there's a lot to all of this, but at this point, I just wanted to get back to the smoke-free workplace policy and what you feel about changing that or keeping it the same, or at least making some edits to it.
So as it's written right now, anyone who is not an employee could smoke cannabis or vape on the campus. And the question is that since we have restricted our employees, should we also consider whether we want the campus to be smoke-free, which include vaping, all the other ones listed, lighted cigar, pipe. But we should include maybe vaping also. And I guess going to open that for discussion. What is the committee's thoughts about whether we should do that or not? Cassie had her hand raised.
So the first thing I wanted to clarify is, if I understood you right, there shouldn't be any smoking out here out front? I guess I just want to clarify that.
Well,
the way you read the policy, it sounded like all of the smoking should be at the law enforcement center or behind the building. And if you could eliminate it out here in front, that would be awesome if we could enforce that. I'd be happy with that much.
That's
Yeah,
correct.
the out front thing's by employees, Cassie. The employees shouldn't be out front. But the public, because we don't have a smoke-free campus, the public can smoke anywhere outside. They just can't smoke in the building.
I'd like to move away from the doors, because anybody who's got asthma who tries to walk through the smokers is dead when they hit the building. I just like away from the doors.
Right, the cans are a certain number of feet away from the doors, and you're not supposed to approach. There's signs that say you're not supposed to be any closer than the posts, basically, are. But again, it comes back to a matter of enforcement. Somebody's got to enforce the regulations.
Well, I do point out the signs when I can't get through the doors. They do say the sign's back there, but I wish we could enforce that. I think it's kind of hard to eliminate it, but if that's the choice of the board, they can. But I'd like at least they removed away from the doorway, if possible.
Dana?
So this discussion is just the smoke-free workplace. This is not a cannabis discussion. Is that correct?
No, this is a smoke-free environment. But as Melissa pointed out, that anywhere you can smoke cigarettes, you can smoke cannabis. So, I mean, that's probably bringing up the whole subject, whether we want a smoke-free environment on the entire campus, whether we want to limit it to certain areas for employees.
I think if you almost have to go smoke-free the entire campus. And the reason why is because hemp, and people do smoke hemp. You can buy hemp flower, you can smoke hemp. Hemp is not considered cannabis. And that email I sent out to everybody, I made an error because I went back through and I read the state law. And under the definition of cannabis, if anybody wants to look up, it's under section 3. It says, under the definition of cannabis, it does not include hemp. So you could have an employee smoking cannabis. Another employee says it smelled like it, it looked like it, they smoked it in a bowl, and turn them in for smoking cannabis when it does not meet the state definition of cannabis. So I see there could be a big, can of worms here that you're going to open up later on. So I think the only way to avoid that is you just have to say you can't smoke anywhere on campus. That's for the employees. The public, well, they're a different matter.
Matt?
Okay, just to be clear, so currently, there is no employee use of cannabis allowed, but there is a use of tobacco products by employees. Is that correct, Melissa?
That's correct.
Okay, so what we're discussing here is going to a completely smoke-free campus, which would disallow employees and the public from using tobacco products or any other products that you smoke on the campus. Is it just this campus or the barns? I'm just trying to get a lay of the land here.
I think you'd have to do it by local law, and you would, in your local law, do that definition of where.
Okay, so it hasn't got to be everywhere. It could be wherever you specifically say.
Correct.
Okay.
Although you'd want to have a really good reason for allowing, folks to smoke in one place and not the other place. But You could definitely pick and choose.
And so
You'd have
if we
to have
did
some kind of
allow,
rational basis.
if we did allow smoking in a specific place on campus, i.e. the gazebo, which we don't have anymore, then they would be allowed to smoke tobacco, but not cannabis because that's not allowed in the handbook.
Who's they? Employees?
Yeah,
Yes, that would be the case.
but then if you were smoke-free other than the quote-unquote gazebo, then no one could smoke out front, public or employee, tobacco or cannabis.
Correct.
Get a needle and thread here, don't we?
We do.
And there
Or
is
you can say, I don't care.
currently a gazebo over at the law enforcement center. So those employees do have a gazebo. The one behind our municipal building here was removed.
Roger, you had a comment?
No, I was saying Matt's correct. Or you could say, it doesn't matter to you. Because what a smoke-free workplace does is it takes anything that smoke, vaping, whatever, however you define it, takes that out for everybody. Okay? If you don't want people, the way the law is written, if you're okay with cigarette smoking and not with cannabis for the public, you can't do that. It's all or nothing. Because the two of them, as far as the smoking regulations are concerned, are intertwined. So it depends on what your goal is. If your goal is not to have anybody smoking anything, that's a smoke-free campus. If your goal is not to smoke cannabis, you can't do that. You can only say smoke everything. Employees are not allowed, due to the drug-free workplace, to use cannabis during working hours any more than they're allowed to have a beer during working hours out back, because it can be an intoxicant, unless, as Mr. Half has pointed out, they have some kind of medical card or medical reason for using it. And then they're not allowed to use Vicodin out back or in their cars or during lunch unless they have a prescription for it and take it the right way. And then if anybody comes to work for whatever reason impaired, we have the right to send them home. And if that is a repeated thing, then discipline them accordingly.
Melissa was first, and Dana.
I just wanted to if we refresh our memories a little bit, the smoke-free workplace has come up in the past as far as putting a policy out that does not allow employees to smoke on the municipal campus. There will be effects if we make it a non-smoking campus, and we have to be ready for two things. One is to enforce the policy. And the other is that, most likely we will have employees lined out on either the sidewalk out in front of the municipal building or possibly across the street, across Route 4 there. So that has been one of the things that I think that has deterred the policy from changing in the past, but just something we should be aware of, I think, going forward.
Dana Half?
If you're going to go smoke-free, I think you also have to include vaping, because New York State does not consider vaping smoking. And I'll give you an example. Back before this new law was passed, the medical marijuana, it said that you could not smoke marijuana for medical marijuana, but you can buy marijuana flower, just like pot, to vape, not smoke, vape. I don't know the difference, but if you're going to go smoke-free, I think you need to also include the word vaping.
So Roger, just a question. So we could do a smoke-free campus and include those campuses that we have, Burgoyne, whatever else we decide that we want to include in that, which means no one could smoke on the campus. The second option could potentially be that we have a smoke-free campus with the exception that employees are allowed to smoke in designated areas. Is that considered discriminatory against the public who can't smoke anyplace else?
No, no. As a matter of fact, I think we'd be required to bargain the impact of a smoke-free workplace should the unions request to do that, and that might be a result of the impact bargaining. Other things might be a longer break time so that they could go to a place where they could smoke. I mean, it'd be impact bargaining. So we have the right to do it, but we still have to bargain the impact of what that decision would be on our employees.
Dan?
Yeah, Roger, just so I can understand all this, if we voted to have a smoke-free workplace on campus here, and
No.
somebody had a prescription, a medical prescription for smoking cannabis, can they still smoke that
Well,
cannabis on?
As Mr. Half said, the medical, there is no smokable as you're used to thinking of it as let's think of it in a parallel with tobacco. Medical marijuana cannot be consumed by burning it. It can only be consumed in certain ways. It's only sold in certain ways, one of which is vaping. As far as the Clean Indoor Air Act is concerned, vaping and smoking of tobacco are the same thing. So what you've got now is a situation where the legislature has decided that burning of marijuana is equated to the burning of tobacco. So both of those things are intertwined now and are allowed to happen in the same places.
So would they be allowed to vape, is what you're saying, if they had a medical prescription from a doctor?
Yes, because that's a medical issue, not a.
Yeah, oh, I understand that. I'm just curious how the policy works. Thank you.
Mr. Half?
If you have medical marijuana, you don't have to smoke it. You have tinctures, you have gummies, you have capsules. So the patient has many other ways of consuming it without smoking and bothering our smoke-free policy. I would suggest that this, instead of doing all this smoke-free workplace, that the handbook be amended, and where the handbook says the word cannabis, you change that to adult use cannabis. That's the definition of what we all think of as pot. So if we do not allow adult use cannabis, it now is equal to alcohol. The law does not equal it to alcohol, which is stupid. It equals it to tobacco. So change the handbook, call it, you cannot have adult use cannabis in any form. Medical marijuana people, if they want to take a tincture or a gummy, you won't even know it. That would be fine. And the only problem is if somebody wants to smoke hemp and someone turns them in, that person can find the receipt, keep the bag, whatever, try to prove it wasn't adult use cannabis, it was hemp. It's a little bit sticky, but I don't think anything we come up with is going to be the perfect unicorn here. So I think if we just change the handbook to say adult use cannabis is not allowed during working hours, just like alcohol, and leave the rest alone.
The handbook and the smoke-free workplace are two different things, though. I want to emphasize that. One deals with everybody. The handbook is a subset of people who are on our campus who are employed by us.
Right.
So that's two different. There are two different issues. One is everybody on the campus. That's smoke-free workplace, and we've been approached numerous times, at least 3 I can think of, I believe, by Glens Falls Hospital, and they have a smoking cessation program, and public health jointly proposing that we become a smoke-free, before this was ever an issue, proposing that we become a smoke-free workplace. And the question was always, is there a will to enforce this if we so chose to do it? And the answer is always in the past seemed to be, no, we're not going to regulate that vice. So if we're not going to regulate that vice and we're not going to regulate the vice of adult use cannabis, to use Mr. Half's phrase, then you need do nothing. That's for the non-employee part of it. Employee regulation would take place in the Employee Handbook, which is the book that discusses the relationship, doesn't form a contract, says it right in the beginning, but discusses the relationship between the county and its employees, their benefits, their obligations, et cetera. That's a separate issue than the smoke-free workplace. You would subsume one within the other. So think of it as concentric circles. The employees are in the inner circle, smoke-free workplace is the outer circle. You would, by doing the outer circle, include that subset in the inner circle. But we'd still have to bargain the impact with that outer circle.
So,
Or the other option is to say, that's the way it's going to be. That's the way it's going to be everywhere else. You know, you're walking down the street and the guy upwind of you is smoking. There it is. It doesn't really matter what he's smoking anymore.
Sue Clary, you've been patient.
Yeah, it was a, you think about smoke-free policy and you think about, like at the Salem School, take for instance, when they implemented their smoke-free policy, you know, everybody came in front of my house by the fence and they smoked. And that's that transition, because it's transition is hard. But now there's nobody out there smoking. Everybody's fine. It is, the campus is smoke-free. We all got used to it. It took a few years, but now it's a smoke-free campus, and I think everybody's glad of it. You don't see them smoking on the athletic fields. You don't see visitors smoking. It's just a thing that we've gotten used to. I know to make that switch could be difficult, but it will even out. And that now seems like a good time to think about a smoke-free policy. I mean, what's
And
going to be the
schools-
harm?
Schools and healthcare facilities were handled by state law, by the way. So that's why they are smoke-free. They didn't have to make a decision or pass a local law. And I know at least in Hudson Falls, where my kids went to school at the time, the enforcement is done by the administrators who are out there. And then they have obviously powers to enforce their the violations of that process. And we would then have to do something where we set the ban where, and then have some kind of wherewithal to enforce it with penalties.
Day and a half?
Roger, you're right. One does affect the other. The drug-free workplace and the non-smoking, they do affect each other because we're talking cannabis or hemp. We're talking the same thing, affects two different things. I think you got to go smoke-free campus. John LaPointe has been trying for years and years and years to do that. Never could. But with cannabis, I think you have to go smoke-free because it's too hard to thread the needle to figure who's smoking what. Are you smoking adult use cannabis, or are you smoking hemp, or are you smoking cigarettes? It's just too messy, and we don't want to keep. You're going to be policing it constantly. No smoking is easy. Are you smoking? Don't do it. It doesn't care what you're smoking. Just don't do it. And people will eventually come around to doing it. The employee handbook, I know that's probably not this committee, but the word cannabis needs to be changed to adult use, because by keeping the word cannabis in there, you're telling people you cannot be a medical marijuana patient. And they have disabilities. And Roger's going to say no, but we're going to get sued. And we're going to
Roger's not going to say no. What Roger's going to say is, I don't believe there is an approved medical form of cannabis in New York State that can be consumed by smoking. Vaping, I think I would agree with you, and I'll have to go back and look at that specifically. But my understanding was always in New York State, having had relatives in Massachusetts and having this discussion, that New York State does not approve a medical use for combustible, let's call it combustible marijuana.
Yes, but the handbook says cannabis in all its forms. And you're talking adult use cannabis because you're talking it's equal to alcohol. And the only cannabis that's equal to alcohol is adult use cannabis. So in the handbook where it says cannabis, just put adult use cannabis. That fixes all the problems there. As far as the smoking on campus, I can't tell hemp from pot. I don't think anybody can, unless you smoke it. And if nothing happens, guess what? It's not pot, it's hemp. And you smoke it for the CBD effect. And people do smoke it for the CBD effect. And I think it's going to be very, very sticky trying to police who's smoking what. It's very easy to police smoke, just smoke. Or vaping, if you want to include that also.
Mr. Henke?
I think we also ought to talk a little bit about a couple of levels of compassion here, and I
I support Dana, I supported John LaPointe for years about the smoke-free campus. I think that's not a bad thing to do, but we got, I think, two levels of compassion. One is for the Cassies and Bob of the world that are pretty allergic to cigarette smoke, running the gauntlet in here, and I always kick them out and they, well, stand in the rain, but, you know, I think we've got to do it. If we do it for our employees, we've got to do it for everybody. I think, so therefore, I kind of support Dana's smoke-free campus, but I think we also ought to have a level of compassion for our employees that do smoke. You know, 8 hours is a long time to, you know, to sit here if you are, you know, a smoker. And I don't see any reason to not put a gazebo back out back and then negotiate the, you know, the effects and the work order effects that Roger says we ought to. But, you know, we could certainly provide something like that instead of making them go stand on the sidewalk. That sort of thing, that doesn't show much compassion for our employees either. So I think I would talk about, you know, smoke-free with the exception of our new gazebo that we're gonna put out back for $900. The Argyle Structures, by the way, makes them over there in Argyle, so if you wanna bid one, I could have them delivered tomorrow, you know?
We gotta open up the bid to all the others.
Yeah. I think we've got a whole other discussion that we're gonna have to ultimately have about the medical marijuana, because, you know, I think that we don't want people, you know, at work, you know, intoxicated. And, you know, I could have, you know, be using medical marijuana, whether I use gummies or, you know, who knows what kind of, you know, injection. And, you know, to make my hip not hurt, or I could have 2 or 3 slugs of gin, which would do exactly the same thing. And I don't think we want, you know, employees working, you know, dealing with the public, dealing with, you know, important documents. All our jobs are important here on this campus. I don't think we want them doing that impaired, whether it's a medical function or not.
We already have rules that deal with the impairment issue. So in other words, if you have a prescription, right? So you legally possess, they can legally consume, and the prescription says take 3 of these things 3 times a day. You're going to take one probably around lunchtime. You can legally do that. You can legally do it under our current rules. However, if that then impairs you to any extent, then we would send you home. We would find out why you're impaired. And if it was my doctor gave me drugs, I took the first dose and that didn't realize that I was impaired, we'd probably handle it one way from, oh yeah, every time I take whatever it is, it makes me a little loopy. So there's no difference now to what, you know, whether it's marijuana, whether it's a beer, whether it's the Percocet prescription you got after going to the dentist, whatever, you can't be impaired at work by legal or illegal substances.
Especially driving.
Well, right, that's not real. For our guys, there are certain, and for driving, it's the same way. Whether you're sitting at your desk or driving one of our vehicles, for the general employee, you can't be impaired. For those that are governed under federal law, there are certain other much more strict rules about there is no acceptable use of certain substances for those people. Therefore, because they're listed on the federal schedule, therefore the rules would be different for folks that hold federal licenses because the federal government says so.
8.5.
This comes back to my point of where the handbook should not just say cannabis, because medical cannabis, I'm going to read here from the state law. Medical cannabis shall not be deemed to be a drug for purposes of Article 137 of the Education Law. Then it goes on to say certified patients 21 years or older, and it goes a whole bunch of other verbiage. It says, Section 42, protections for the medical use of cannabis. Certified patients shall not be subject to arrest, prosecution, or penalty in any manner, or denied any right or privilege, including but not limited to civil penalty or disciplinary action by a business or occupation or professional license board or bureau. So if you put the word adult use cannabis, you avoid all of this. And Roger says you don't want people impaired. You know, the medical use cannabis comes by prescription. Dosages by prescription. A pharmacist tells you what your dosage is. And Bob, people that use medical cannabis do not walk around stoned. They're so used to it, they get the medical effect.
Okay. Well, coming back to it, I guess it's for the committee to decide should they want to proceed with a local law for making this a smoke-free campus.
I might suggest that if you're leaning in that direction to going toward a smoke-free campus, that we could get the folks from public health, and I want to say it's Glens Falls Hospital's program that was encouraging us to do it, to come in and talk to you about what that involves, all that stuff, if that's something you want to pursue. They've come in before and they've been met with a sea of silence, and that's been the end of it. But if we're looking at doing it, then let's go about it in a methodical way and have the folks that know about that kind of stuff come in, talk to us about what it's involved, talk to us about the experiences of other places. We also have the parks. Do you want to make those smoke-free? That would be probably one of the first places. And I know talking about the parks being smoke-free were one of the first places that those folks talked about. So we've got properties all over the place for all kinds of reasons. So I would suggest to you, if there's a consensus maybe to go down that road, let's do it in a slow and methodical way.
Matt Hicks?
Two questions. Can I assume that schools and other public places in the county, they're like school campuses are smoke-free?
Schools are regulated by the state, as our medical facilities.
Okay.
They don't have a choice.
I guess the three options are, Roger, leave it the way it is on one
Right.
extreme, go completely smoke-free everywhere all the time, 100%, which is the other extreme, and then you're suggesting that perhaps there's a place in the middle where we could come to an agreement that there might be places on each campus that does allow smoking, and then we'd have to sort of delineate that all out, going slowly and make it really in depth on what's allowed where, and then have an enforcement procedure after that.
Right. Well,
Those are the three options.
The entire ban would require an enforcement procedure as well. But what you could do is do something along the lines of a local law. If you do an entire ban, let's say you did the entire ban, the far end of the spectrum, the two ends are do nothing, do an entire ban. An entire ban will still require, for the sake of the employees, some kind of impact bargaining, I believe. So the result of that could be one place where you would allow it for the employees after impact bargaining, okay? For example, you could also say the public is only confined to these certain areas as well, but then again, that requires, back to, okay, it's defined by this square, and what if I'm standing on the outside? So the enforcement is still an issue. So that's why I'm saying that there are folks that have done this and planned it out and have been here before. Why don't we talk to them about, how it's been done in certain places, how they would propose to do it. I mean, you still have to do the enforcement at the end of the day. But this is something that's been studied by folks with way more knowledge than I have, certainly. My only expertise would be in talking with the employees, should you decide to do some kind of ban that's different than what we have now, which is basically they have to, or they're supposed to, stand out back. That's really the only requirement we have now for employees. And that policy is only as good as the enforcement. So if I, as a department head, see an employee smoking out front and I say nothing, it means nothing.
So you had another question, Matt?
No.
Okay, so
What could be interesting is, and then you do the smoke-free policy with a gazebo out back. So now you've got employees out in the gazebo. On one side, they're smoking joints. On the other side, they're smoking cigarettes. And I'm sure everybody's going to be really happy together. That's number one,
but they can't smoke joints.
Right.
Right. They shouldn't be
They can't
using
smoke cannabis.
use cannabis at all during the working hours.
Employees.
Well, that'll be a different conversation. You'll find that out. And the other piece is that I think that's a great idea about bringing in someone that has kind of walked through it, whether a healthcare, Glens Falls Hospital, Hudson Headwater, someone to come and talk about how do we go about this in a informed manner, right across the board, before we make a decision.
John
And
Rozell?
start with some information.
Well, I want to thank Bob for sticking up for a smoker a little bit. I'm a smoker. I've never smoked in the public, down on the campus. It's always been inside my truck. I do sort of respect people, but there's some people that wouldn't. But as a smoker, I'm going to have to go against a complete shutdown on campus.
Sam Hall?
Yeah, I was just gonna say, I agree with Roger on the methodical part, but I don't think it has to be slow. I
No,
think,
that doesn't mean slow.
Okay, well, you said slow methodical, so,
Well,
whatever that might mean.
Right.
I just think that we have, since the days that, John LaPointe was here, we've carried on with this and we haven't really come to a consensus on it. We had the health people comes before to talk about it. We need to do that again and do it in a methodical manner, but I just think it doesn't need to be something that's a slow, drawn out process. It's pretty simple. If the experts say that's the direction we ought to be going, then we should probably be doing that.
it's never received any kind of positive reception when they've come in the past. It's always been a thank you very much, and then we've moved on to the next subject because there wasn't much interest in going down that road. If there appears that there is now, we should listen to them. I would think.
Yep. I understand, Roger.
Dana?
Roger, if we do not go to the expense to buy gazebos and employees smoke in their vehicle, and their vehicle's parked on the public parking lot of the campus, is it still considered can they go and smoke inside their car and that would be okay?
Not if there's a ban,
They just have to drive over to Dunkin' Donuts or something.
or walk out to the public right of way, like you saw with Fort Hudson when it first went into effect. Now, the question is, are you going to enforce that? Are you going to have somebody wandering around the parking lot?
No.
Right. That's kind of where I'm coming from too.
No, but a department head can consult with their employee, and when it's seen, and have disciplinary action. There's a follow-on effect. You don't have to run over there and say, stop immediately.
I agree. That's the way it should be now as well.
All right, I had Cassie.
I just wanted a clarification, Roger. Bob mentioned, is there a way we can make it can you make it a smoke-free campus with a spot for the employees or not? He mentioned it, I just didn't know if that was an option or a wish list.
I think that's possible through impact bargaining.
Okay. I don't want to be thinking about that option to find out it's not legal, so I want that.
Melissa?
I just wanted to mention, as far as the employees are concerned, I think it would be important to put up proper signage for the employees and the public if we're going to do this. And I had brought this up also a couple of years ago as far as the health insurance aspect when we were trying to minimize our claims that we're going through. And I think it would be important that if we were going to go smoke-free, to really put some effort into tapping into Blue Shield's resources. They have smoking cessation classes, get that information out to the employees. So, to assist them in any way we can, because this is certainly going to be a big transition for our smoking population.
Okay. Good. Dana, and then last one on this subject, we'll move on.
All right. I'm a little bit confused about how you can say yes to one and no to the other. Roger, we can say it's a smoke-free campus and the public cannot smoke anywhere on the campus, but if you're an employee, you can go smoke in the back at the gazebo. Isn't that two classes of people?
Yes, but I don't have to make a comment. The public doesn't have a choice about when and how long they have to be here. The employee, The
Okay,
employees have to be here.
and that's an
Matt
argument then that argument will hold up?
Well, again, I don't want to impact bargain with myself in a public meeting.
Well, I don't think we should be afraid of bargaining, you know, it's a.
But there are many
We're not afraid.
possible solutions during the impact bargaining, and that might be one of them, but there may be many others that I haven't thought of that I'd hate to get boxed into a corner with, I guess is my point. The point of fact is, if we impact bargained and that was the solution, then that was the solution.
Matt Jones has the floor.
I was just gonna give update on the parks and the smoking policies there. It is no smoking on the beaches currently right now, but in the park area, it is allowed in the, the bigger open area where the picnic tables are. But the beach it is.
Cassie?
Is there another option too, where if we did go smoke-free in consideration of our employees, either first we do give them the smoking area, or we give them a smoking area for a certain amount of time while they adjust to the smoke-free area, so they didn't have to go cold turkey? Is that a possible option as well? I'm just trying to see what options are out there.
I think that would be part of your impact bargaining with doing that. In other words, the impact is going to be, we could phase it in for employees or phase locations in, or that's again part of the impact bargaining. So we'll give you a certain amount of time to do whatever. We'll give you a certain amount of time. It takes mostly, we'll fund smoking cessation programs. We'll do that's impact bargaining. How is it going to affect those employees? What's the impact? We can make the decision. The question is, we bargain over the impact of that decision on them.
Dana, anyone else have any? Dana's,
Dave, I know you
Dana?
want to speed this up, but people are raising their hands. You got to let us speak.
no, I just wanted to make sure other people who hadn't spoken had the opportunity to speak.
All right, I'll give somebody else a moment to speak if they want.
Is there anyone else? Dana?
Okay. If an employee is a smoker, can an employee at 10 o'clock in the morning say, I'm going to go take a break and leave their workstation and go smoke during the day? Or are there specific times they can smoke? I hope they just can't get up from their desk and leave while another employee is diligently working. If they have certain times and that time is lunch, then they can get in their car and leave the campus.
The contract or the handbook provides for 2 10-minute breaks, one in the morning, one in the afternoon, in addition to your lunch.
Okay.
So how each department administers those 10-minute breaks is up to that department. Some of them I know have a, you got to tell me when it is, or, you take it at a certain time because I have so many people I have to rotate through that and they're scheduled. Other places they're smaller, like me, would be like, you know what, I'm going to go out and take a quick walk around the building. There's nothing going on. Okay, have at it. And that could be any time in the morning.
But nothing stops them in that 10-minute break from taking a drive around the block.
No.
Melissa, do you have something else?
I just wanted to clarify, the current policy is actually titled Smoke-Free Workplace Policy. But in our policy, really all it does is adhere to the New York State Public Health Law, which states that there's no smoking allowed within certain feet of entrances, as well as indoors and vehicles. So even though we're calling it a smoke-free workplace policy now, really all it's implying is that we're not allowing smoking inside those areas. Currently, we do, the policy right now states that employees can smoke in those gazebos provided. For whatever reason, someone made the decision to remove one of the gazebos, and that could be why we have the overflow of employees flocking to other parts, like the front of the buildings, because they probably have no other place to go. And we haven't really done anything to enforce the current policy.
Mr. Hankey?
We keep talking about enforcement. That's no real problem. All you gotta do is have the sergeant at arms patrol the parking lot 2 or 3 times a day.
He's here most of the time anyway.
Yeah.
Sue Clary?
So in the smoke-free workplace policy, Melissa, the definitions of smoking means the lighted cigar, cigarette, pipe, and anything that contains tobacco, which would now include vaping and cannabis. Am I correct?
I think we should add,
Those would be included to be smoked in the gazebo or an off-place site place at this point. That's what we're talking about?
by adding vaping, that would mean that they would have to smoke in the designated areas, correct?
Yeah. And also cannabis?
Cannabis used by employees is not going to be allowed
That's under the Drug
During
Free
work
Workplace
hours.
Act.
during work hours, right?
That's the federal law.
So the federal law says that employees can't smoke cannabis during work.
They consider marijuana a Schedule I drug, which is the same classification as heroin and cocaine. So unless that federal law changes, and the reason we need to adhere to the workplace, Drug-Free Workplace Act is because we depend on federal funding. If we did not adhere to that, we would, lose or could lose that any federal funding that we receive.
So it's a federal law that we're following within New York State. So it sounds a little convoluted.
The problem here is New York State has different laws now than the federal government. So yes, there's an issue there.
So Washington County sits somewhere in between.
Well, the Supremacy Clause of the United States Constitution says federal rules and regulations and laws govern over state laws. So while you're at work, our employees, because we receive federal funds, can't consume that kind of stuff. The minute they go home, though, I don't have control over their activities anymore. So they can consume whatever New York State says is legal, except if they hold a federal regulated CDL, which then says you cannot consume at any time those materials. Or carry a firearm, which federal law says you cannot consume those things at any time.
So is legal pharmaceutical marijuana under that federal law?
As far as the feds are concerned, there is no such thing as medical marijuana.
So how can we differentiate between the two with medical marijuana and smoking of cannabis?
We would not, in situations where you are carrying a firearm, for instance, or driving a truck using a CDL, we would not differentiate.
But what about a regular employee?
Use the federal law. A regular employee, I would err on the side of being honest with you, the prescription, because I'm not a doctor and none of us here are either.
Right.
Medics?
I think we should head down the road to start headed towards a smoke-free workplace on all our campuses. Do I need to make a motion, Roger? Do I need to move it to a different committee? Are we going to co-committee it with Health and Human Services? How do I get us to make the leap, make the next step?
I think if enough of you say, Roger and Melissa, why don't you get in contact with those folks and set them up for the next meeting, we'll do that.
Would that be for this next meeting or for Health and Human Services?
I guess that's
Health and Human Services tomorrow.
well, I don't think I can get anybody, I don't know, maybe I can get anybody in tomorrow, but I guess I'm going to let you guys argue about what the jurisdiction is about,
So my proposal would be is to have someone come back at next coming ops meeting. While they're doing that, I think that Melissa and Roger and Matt and whomever else be involved to sit down and figure out what are the options. We talked about should be smoke free at the park, should be smoke free at some of the barns. Where should those be? I think they should prepare sort of that list. Meanwhile, I think Roger could start looking and drafting a law that we could start introducing after the next meeting to put it in place. So I think we can do that, and we'll have the education, we'll have the research done, so we'll have a parallel structure going on to move forward. Does that sound good to everybody?
I would support that, and that's him, Matt, not me, Matt, by the way. I'm on the subcommittee.
Matt Jones.
Yeah, okay, thank you.
We might get you in the working group.
No.
Dave, everyone works better with a deadline. And I think we should have a smoke-free campus by January 1. And between now and January 1 is when we have these people come in and talk to us about how to achieve a smoke-free campus, not if we should. It gives them a better, they know what they need to do, what they need to talk about, because otherwise it's too smoke and mirrors, pardon the pun. But I'd like to make a motion that we have a smoke-free campus January 1, 2022. And between now and then, we figure out how to do that.
Maddox has got a motion on the floor.
Did I make a motion? No, I was supporting what you said.
Okay,
Your statement made sense to
okay.
me that
All right.
I think we should,
Okay.
and I agree with Dana, that would be the latest date. I hope we do before then.
I would think that we could have it done before that. I would think probably by August 1st.
Tomorrow would be nice.
You guys are going to be overachievers, really?
I heard deadlines are good. I thought I was gonna hear next month.
We're just committing Rogers and Melissa's and Matt's time, and anyone else needs to support that work to support them.
Only in Hartford do the wheels of government do a burnout.
No, we're gonna prove to you, Dana, that actually you could be wrong.
So Dana,
I don't know why I'm not on this cannabis work group of anybody here. This is the first I've even heard of such a thing, but that's okay.
I'd
I'm
say
not
something
either.
now, but Dana. So Dana
That's
made
my-
a motion to move forward towards a smoke-free campus. He said January 1st. We'd like to modify that to August 1st.
Well, it can be that's the latest. That's the deadline. That's the
Okay.
deadline. You can always do it before.
Okay, got a motion, Dana, do I have a second?
Dana, I'll second.
Second by Matt. Ferguson seconded. Along with that, for the next Governor Knopf's meeting, we're gonna have them schedule people come through. We're gonna start working on the areas we can do and start drafting a local law for consideration. Does that make sense? Okay, all in favor of the motion?
Aye.
Opposed?
I,
John, you opposed or for?
I'm sticking up for the smokers. I oppose.
Okay, thank you. Just wanted that clarification. Okay, motion carries. Thank you, gentle people. We'll talk about that later, and next meeting, we'll try and get someone here and talk to us. Okay, the last thing on the agenda was live meetings. We're coming to a point where people are starting to open up and gatherings are more accepted. I was asked to talk about live meetings, getting back to live meetings where people come in. We also understand that there are some people who may not be able to get here, and attendance would be much easier by Zoom. So I'd like to talk about people's feelings about coming back to more live meetings, get more interaction going, and also permitting hybrid meetings or Zoom meetings in the future. So, Cassie?
So I think we're already doing that. If you're available and you can come in, that you are coming in, that if you can attend by Zoom, you're attending by Zoom. So I think we're already doing a hybrid and it's working well. I don't think we can eliminate the option for Zoom right now because of the health restrictions that are still out there. I think there's too many chances and too many days where somebody might have a headache or they might be having an asthma attack or dealing with a common cold and they can't come in. And if you eliminate the Zoom, then they can't participate. So I think with the restrictions that are still on there now, that we should just continue the way we are. Either you come in if you feel like it, or you attend through Zoom.
Dave?
Dana?
I agree with Cassie for a little bit of a different reason. I think when we have our live meetings, you know, you turn around and you look, it's like employees are there, that they're the public. I think we have a lot more public with this method, and this could be hybrid. I'm looking right now and I see 1, 2, 3, 4, 5, 6, 7 people are actually at the county. I think this hybrid model works very well.
It'll be all right, Dana. We can provide you with a map. You'll be able to find it.
You're not going to take me through Argyle, are you?
We're going to leave you in Argyle.
Construction area, you won't make it.
Please don't.
Well, so I tend to agree with you, though. I find these kind of meetings inefficient. When I think back to when we met in person, I'd like to try to promote that we get back in person as much as possible for the committee meetings. And if there's a way that if a person or two can Zoom in because they have an issue that day, have that opportunity. So if Sandy knows there's two Zoomers, then we'll do, but if nobody's gonna Zoom in, we can just have a regular meeting. It just seemed the back and forth and the overlap and the talking, I don't think we accomplish as much when we're not meeting in person. If we could try to promote as many of us to come back whenever we can, but still have the option so that if, I'm on vacation in November and Dan's on vacation in February, and instead of missing a meeting, we still can Zoom in, but we're transitioning back to the old days if we can. Just a thought.
Dan?
Well, I totally concur with that. But I see the point that Cassie and Dana make, and I don't know if there's any happy medium, but you don't get the involvement and participation unless you're up here. I've noticed that in myself. I tend to take less interest if I'm not up here than when I'm home sitting in the Zoom meeting. And I think it makes for better government if we can attend the meetings, but I also know the point that sometimes you can't, and I don't know the answer to that, but I'm hoping that board meetings definitely will be required attendance to help facilitate going forward. I mean, it's necessary. It's the same at the town level. I mean, if we had Zoom meetings at the town level, we would not get the participation we get by actually attending. So that's just my opinion.
Cassie?
I think it's gonna be like, some of the employees said, they find they accomplish way more work when they're at home, and some find that they can't concentrate when they're at home. So that would be on us as a supervisor to decide, like you said, you can't pay attention when you're not here, so I guess you should probably come here. But those of us that can focus and pay attention and do it from home, I think it's okay. Plus, I think in the beginning, we may have had a challenge with this interaction, but I think since then, we've compensated. Dana's participated nonstop, he's from home. I've had my days where I run my mouth and I'm home, do comment constantly. I don't think we are not. I think we are still handling the government job and moving forward. And I really don't think you can eliminate the Zoom if you want to fully have everybody's participation due to the health restrictions. It's not going to happen.
First of all, no one's suggesting eliminating Zoom.
I know, but
No,
I'm just saying that.
I will tell you that here are some comments and observations I've seen. I've heard people say, well, we talked about that. I didn't hear it. My connection was bad. This is bad. That was bad. We even see people that are very close to here in Kingsbury whose internet goes down and they can't hear what's going on. So I agree, but I think that I don't ever said I think Zoom can be a great thing, but I do think that there has been a lot missed by people, especially when their connections are going down, up and down. I think the interaction is better, and so that's what I've observed. So I think that we need to start discussing this. A number of other counties have started going back to live meetings. They found the benefit of it. Warren County's been back for a few months now, so they are too. So, Sam Hall?
Yeah, Dave, just a couple of things I'd like to point out. That first of all, that if under CDC guidance, as we currently stand as of today, if anyone has not been vaccinated, when they come in, they will have to wear a mask and they would have to be 6 foot away from other participants. That would be to the right and to the left. We certainly can put the dividers between there, as we have done in the past, to cover that aspect of it. And that's the current guidance. That's not what it's going to be forever. I think that the hearing aspect of this Zoom is an issue. I remember a few meetings ago that Supervisor Rozelle asked me a question, and I gave him an answer, but it wasn't to the question he asked because I heard the question wrong through the sound system. So I think the hearing aspect of it is an issue. But I also think there's value, as Dana had said, that with the meetings being on Zoom or continuing that, more of the public gets to see them, more of the public gets involved and has a better feel for what's going on. So, there are some things we will need to do to move in that direction, as long as the guidance stays the way that it is. And I'm certainly not opposed to, for people coming back, but I also understand that we have some individuals that, because of health reasons or whatever the case may be, at this point in time, cannot participate or probably shouldn't participate in a live meeting.
Roger.
Get my hand to be seen there. So there's two issues. One is supervisor participation in meetings, and I'll call it the Zoom method has always been allowed. Supervisors have always been allowed, even pre-pandemic, to participate in meetings as long as they can be fully heard and seen by all the participants in the meeting. So continuing that is not really an issue. That's always been allowed. We've just upped our game technology-wise to where we're actually, it's an easy thing to do versus maybe before we didn't know how to do it. The second question is public participation. And we've been operating under the governor's executive orders that have allowed us to substitute public participation at meetings by using Zoom to broadcast to the public. That executive order may expire at some time, in which case we would then have to allow, our public meetings would then have to be in-person public meetings. So I think it's due to expire fairly, or would have to be renewed. The current order is going to end fairly soon. So, and then the rules would apply for the gathering rules in terms of, indoor events, how many people, and wearing a mask if you weren't vaccinated, like the chairman said. So there's two things going. And then would we continue to allow the public to participate by Zoom? So the supervisor aspect, we can solve that at any time. Any supervisor previously had the right to say, I can't make the meeting, but I'd like to participate, remotely. And our problem with then was, well, how are we going to do that? We didn't really do that because we didn't really know how, but we've gotten pretty good at it. The public part, on the other hand, is going to be, we're going to have to, at some point, open up the building and the meetings to public attendance and make provisions for public attendance, subject to the rules that have been promulgated.
Well, right now, unless they request it, they can't participate by Zoom. So they're following on YouTube Live, the meeting. So it gives them little chance to participate if they see something come up in public comments.
I can't do three with this hand. The third issue is that, do you want to continue broadcasting, for lack of a better term, your meetings, either contemporaneously with it happening like we do now, or, posting them on the county website at a later date, which we also do. But at some point you're going to, and we aren't letting people in because I believe the chairman's order is still in effect that the building is only open to an appointment. So at some point, I think that option will be taken away from us, and we will have to conduct our meetings with availability to in-person public participation. So there's a couple things you'll have to decide. If you're going to have in-person public participation, for example, then are we going to allow the public to appear by Zoom to speak and or watch, because you don't have to allow comment, watch the meetings simultaneously with their occurrence? Because there would be closed Zoom where supervisors can participate, which is what we're doing now, and then the public broadcasting of it at a simultaneous or later date. So, but right now, I think we are subject to the chairman's decision on reopening the building, quote unquote, able to do live meetings now because the guidelines would permit that.
So I think if we want to encourage people to come to, especially full board meetings, I think there's a few things that have to be done, but should be done. Is I think we need to get dividers between each seat. I don't know what else has to be done. I think we'd have to make a decision whether we want to continue with YouTube or Zoom, like Roger said. But I have no problem with continuing with Zoom or having us broadcast on YouTube. As a matter of fact, there are a number of organizations mandated by the state to have their meetings broadcast on YouTube. I don't see why we'd be different, but it also gives us the ability to go back and look and see what's going on. So
I guess what I was saying is the choice for supervisors is still the supervisor's choice. Mm-hmm. The board can't, I don't think the board can mandate in-person attendance to committee meetings or the board meeting. The real choice the board has to make is whether you want to start to allow public attendance at your meetings. You can encourage all you want that we'd like to have everybody here because it's better interaction or whatever you want to do. But the real choice, really the only choice you have to make as a group is when you're going to start saying public attendance in person will be allowed.
And I think under the current structure, that's still the chairman's choice. Unless we want it over.
Right. That's where we're operating now. I'm not trying to put point the finger at the chairman by any means, but really that's the only choice as a group that you have at this point, not as to whether or not to have Zoom, because if any one of you says I'd like to be able to appear remotely, you have that option.
Okay. Any other discussion? Dan Shaw?
Not on this matter. You referring to other matters?
Anyone else on the meeting subject? Okay, Dan?
My question is, I think it's government ops. Wasn't there going to be a report on how we're making out with the water line going to the nursing home or Washington Center from Summit Lake?
So every time I hit my mute button, I have to unhit it again. So the easements and everything have been delivered and conveyed to centers. They're examining the easements across the properties that we go now. They are examining them. Larry Paltrowitz has been in discussions with them. And so now we're down into what exactly did the easements say and everything, and what would centers, what, if any, obligation would centers have under those easements? I don't believe they would have any, but I guess they'd have to read them and be comfortable with that. So that is where we stand right now, with centers taking a look at those easements.
And how about the property that the well set on? You said once you got this dialogue started with the direction that there was going to be discussion with the, I don't know, with the village or with the town of Argyle. What you had different thoughts on that, Bob, and we were waiting. You said you didn't think we should do that until we got this discussed, and that easement's going to go underneath that property. So it seems like the new owners, whoever they might be, would want to be involved in how they want that dealt with, correct?
Yeah, we'd have to give an easement to centers for the part that goes under the parcel. If we sold our parcel, centers would need an easement to get to the lake, because we don't have to give an easement under something we own. We needed the easement for all the other people that we don't own. So if in fact we were going to sell that, there would have to be a center's easement to somebody else. We would have to give an easement to centers so that they can continue their pipe across what used to be our land to the lake. So if we're not going to sell it, then it doesn't really, we'd still give an easement to centers, because now it would be a separate item.
Oh, I thought we were basically agreeing in a general sense that we were going to sell that 7 acres or whatever there was, maybe it's different acreage, but 7 wells, I forgot what the number was. But 7 was in there somewhere.
Yeah, I think that's the number of wells they've got right now. I'm not sure what the acreage is anymore, because there's 2 little pieces there.
We have to determine whether if it's the village or the town. And how does any of that water the village use comes from Summit Lake? Do they use a backup system at all out of Summit Lake?
I had thought at one point in time that they weren't able to, because they had a algae bloom there, but this last time when they had an emergency, they did use lake water. However, they did not use the pipe. They ran a separate line into the lake to do that.
So there would be no trouble with that, selling that, or the intake would go to the center, and Argyle wouldn't have to have any involvement in that?
Well, there is a why. It does still run from that intake. There is a why that goes to centers.
Well, that's why I thought that there should be some dialogue with your town too at the same time, so everybody's on the same page and know what you want or don't want. I don't want to blindside anybody. Do you feel, Bob, that Argyle should have any discussion with the county on any of this before we?
Well, if that's how you wanted to dispose of it, I think if we did that, I would prefer to have it go to the town than the village, just looking forward in the future. I know some of the horrendous problems that Salem had, you know, when there was a dissolving of the village, had to do with village properties. That's what took them several years, so the fewer village properties there were, the better I'd like it, but, you know, that's the.
Well, I want to make sure that, you know, the town is taken care of in this matter, and so
Yeah, I think we would assume there would be an easement under that. You know, there's no sense having an easement all the way down and then stop 10 feet short of the lake, you know. And I would presume the county would have to give an easement before they, you know, divested the property.
well, then you need to get into that, dialogue now, don't we, Roger?
I guess the timing doesn't matter because if Centers takes the pipe, we're going to give them an easement to the pipe, and then whoever we sell it to is going to be subject to that easement because it's going to run with the land. So so far Argyle hasn't said I want it, so I can't give or sell a piece of property to somebody who doesn't want it. So, and I think
Well, one time I suggested that you send the town of Argyle a letter, and you said you thought that was too early to do. I mean, we have to.
Because I haven't
Send them a
gotten
letter
Centers to agree to take the pipe yet. If they're not taking the pipe, then I don't have to give them an easement across my property. I can just sell the
Well,
whole.
if they're not taking the pipe, we're going to have to think of doing something different. I mean,
If Centers comes up with another.
Stay on top of this.
I think the egg part of this is the easement, getting Centers to take the easement. Once they do that, then everything else is going to fall into place, I think.
Well, once they get the easement, the town won't have any say in the easement or that water line, correct?
Well, I don't think that's, you know, we would object to an easement anyway. I mean, no sense of having a pipe without, like, the last 10 feet into the lake.
So should we leave it that, maybe, Bob approaches town board and see if they want to take that, or?
I've talked to the town board and they're interested. It depends on, you know, whether you're going to charge us $1 or charge us $100,000. That's the, and, you know, some people on the board have said, you know, we want to wash our hands of it, get rid of it, give it to Argyle, and others have said, let's put it in the auction. So, you know, there's quite a lot of board discussion, I think, that's going to relate to, you know, what decision Argyle would make on it.
Cassie?
I thought the last time that we talked about it, that Roger had a plan that he was gonna act on, and this was just an update of what they've done so far, and we can talk forever on the what if, might, could be. So I think we just progress along as Roger's handling it, and we'll get another update next month to see how it's going.
Okay. Day and a half, I'm sorry.
Cassie, I disagree. There's no incentive for anyone to do anything, Centers, village, or town, until we say we are putting it on the auction. Then the town can step in quickly and say we want it, but until we say we're going to put it in the auction, we're going to be talking about this until we have gray beards, even you, Cassie.
Matt?
I was just going to suggest that we charge the town of Argyle. I think it would be fair at 17 chicken dinners from the Argyle Fire Department. That's a fair. If they paid that, then I'd be all for giving to you.
Oh, I go over 34 dinners.
We could do that.
Greedy.
No, I like their chicken.
That might be
I
right.
could do that. I could even do that on 4th of July. I'd buy it myself for you.
Are you gonna make that an motion, Matt?
Well, that's getting the cart before the horse.
Okay.
Or
the chicken before the
cart
water.
before the horse.
Okay, we'll see what progress they make next month.
Okay.
Day and a half.
When is the auction?
We don't know yet.
Okay, I make a motion that when we know that this property is placed on the auction.
You better ask Al.
There's Al.
Al?
So just remember,
No.
you can have an online auction at any time you want.
All right, I amend my motion by January 1st, 2022. Auction this off. Nothing is going to happen until we say we're until we say we are serious and we're gonna sell the property. Then town of Argyle will be nervous that we're gonna sell it to somebody that they can't agree with or whatever. I want it to go to the town of Argyle, but the only way we're gonna make them do it is if we put it on the auction.
Yeah, the town of Argyle doesn't have to agree with anybody, or the village. They have a permanent easement for those wells.
That's okay, but they're gonna be nervous about the owner. You know that. This is life. This is real life.
Maybe so, but they kind of hold all the cards in terms of those wells, just so we understand that.
Well, that's okay.
And,
Sell it, sell it.
and the ability to drill any well, any place on that property, right? Isn't that part of it, Roger?
I believe
Why-
so. I believe
Why
so.
why do we care? Let's sell it. And then it becomes somebody else's problem.
Okay. Bob?
I think that that's a inappropriate characterization of the process. I think Roger's working pretty diligently on it. He's doing it the way he's supposed to be doing it, talking to senators, the lawyers are involved. I don't think that anything has come to a stop, and I don't think that he needs any more whipping. I think he's doing a fine job and doing it as, expediently and appropriately as lawyers do things.
You would say that.
He's dealing with other lawyers. They're all gonna spend, a lot of time, reading and calculating and figuring and doing all the angles. It's a time-consuming process.
This comes back to my point of there is no incentive, and Argyle is arguing that we do not incentivize that.
Did, Dana's got a motion on the floor. I have not heard a second. Do I have a second?
Dan Shaw, where are you?
I'm not on the committee.
Darn it.
All right. The motion dropped.
Just for the record, I love praise when I hear it, Mr. Hankey, but Mr. Attorney Paltrowitz is really the one spearheading this. Melissa and I are the ones calling Larry and saying, Larry, you got to get on this. But
If you don't think Centers is going to see this and say there's no reason for them to hurry up, then you're all need a little gesture, I guess.
Okay.
No, they won't. No, they won't.
Okay.
Then they give it to us without an easement, and we close the pipe off, and they're done.
No, you won't. You're just talking.
Dan?
Yes, I know I'm not on the committee, but I've been working on this for over 6 years. What would be the harm with sending a letter to the town of Argyle? Could somebody make that motion to ask them if they're interested in purchasing it, because we're interested in divesting ourselves of it? I mean, does that hurt? It doesn't impact anything, and it finally makes an official request.
We've heard from the town supervisor. They've talked about their meetings. They're willing to take the property at the price
Well,
they think they
and
can.
that's fine, but with nothing that's official, and it's never beneficial. And like Dana said, somewhere along the line, you have to make this official. I don't understand there's no harm in asking them if they're interested, if we're gonna divest ourselves of it. And then you start the dialogue.
Do I hear a motion on that?
Can we make a motion to send Dan Shaw to the next Argyle Town Board meeting to ask that question, then it's documented in the minutes, so we get an answer?
I guess I just send you a letter back after the next board meeting. How's that?
Okay, just send us a letter back.
Does that make everybody happy? That's easy.
But Dana's right, 6 years I've been doing this.
Okay. Any further business come before the committee? We're adjourned.
No,
Oh, wait, Dana's got to do
Oh,
that.
Dana?
It didn't go anywhere.
Well, no, I
That's
think
the
Dana
problem,
just
that's the
said.
problem with Zoom. You can't see hands sometimes.
how's
Yes,
that?
Mr. Hass.
Where is the continued discussion on the county handbook when it comes to cannabis versus adult use cannabis versus medical
That's in
cannabis?
personnel. That's in personnel.
That's Matt Hicks' meeting?
Yep.
Thank you.
And that will be an in-person meeting with no Zoom, by the way.
And I'm going to bring special brownies for everybody.
That may be a long meeting, but we're gonna break for lunch.
Adjourned, thank you.